For our 20th Open Mic webinar, Dr. Lin Nguyen, he's also a physician and engineer. He took over for Dr. Van, and Dr. Lin will share with us today about hypertension or high blood pressure, which is a highly prevalent and very common condition. It is known as the silent killer, and Dr. Lin will go over the underlying pathophysiology or the underlying science and medicine of the disease.
Okay, good. So the topic today is current trend in hypertension. And why is that important? Because it's very, very common, obviously, right? So hypertension is sometimes we call it the silent killer, right? Because high blood pressure is correlated with cardiac arrest for stroke, all kind of problems. But the thing is, it's silent because a lot of people have high blood pressure and they don't even know it, because it doesn't really get symptomatic until they get really, really high. Sometimes they have blood pressure is high and it's risky, but they don't know they have it. So that's why it's something that we need to address, and that's why there's so much interest in medication to treat high blood pressure. So this little cartoon, it just shows a lot of people heard about hypertension, but not a lot of people know how it's treated or how it's diagnosed. Or some people, when you say you're mad at your children, you say, my blood are boiling, right? So at that time, your blood pressure pretty high as well, right? As I said earlier, hypertension is considered a global health challenge because so many people have them. And so the key is to try to find innovation in treatment and strategy and way to treat and help people bring it down. Because a lot of people have what's called a resistant hypertension, where nothing's really helping them. No medication is not really helping or doing much effect for them. So that's some of the key area that we want to focus on. It's estimated about 1.3 billion people have high blood pressure, and that equates to about 1 in 6 people, which is pretty significant. And a lot of people, they remain untreated, again, because they can't afford the medication, or some people, they just don't know they have it until they go and see the doctor.
As you can appreciate, there are many drugs that are FDA approved to treat hypertension or high blood pressure, and they have been on the market for many years. They are available as generic. As such, they are available at a fraction of the cost versus branded medicine, and this drug has many years of efficacy and safety data. So Dr. Lin will share with you information on this currently available antihypertensive.
One of the things that we at Evergrowth analyze when we look at medication is to look at their mechanism of action, right? So, for example, I'll just overview a little bit of what different classes of blood pressure medication that is commonly used these days. And to overview a little bit of what their mechanism of action is, or how they work. Diuretic is very common. Diuretic is basically medication that help remove excess of fluid and sodium in the body. So basically, you just urinate out all this excess fluid, and of course, by decrease the volume in your body, fluid volume, then decreases blood pressure. ACE inhibitor is also very common. It stands for angiotensin converting enzyme inhibitor. The key here is to focus on the ACE2, or which is the enzyme that is a powerful vasoconstrictor. When the powerful vasoconstrictor, of course, it makes the blood pressure contract, increase the blood pressure. So what ACE inhibitor does, it blocks the conversion of ACE1 enzyme to ACE2 enzyme. So that's how it lowers blood pressure. HARVEY is called angiotensin 2 receptor blocker. Again, the name basically describes what it does. Basically, block the effect of the ACE2 enzyme. Calcium channel blocker is another important class. It basically blocks the sodium entry into the blood vessel smooth muscles. By doing that, then it makes the blood pressure relax. By relaxing, then the blood pressure lowers. Alpha blocker and beta blocker and alpha blocker are classes of medication where it block the effects of epinephrine or adrenaline. Because when you're scared and you have the fight or flight response, then your adrenaline goes up and the blood pressure will go up. And this medication is used to block that. Alpha-2 receptor agonists are actually a target in your brain, where it targets sympathetic nervous system, where it helps the brain to decrease the release of the norepinephrine hormone. Norepinephrine, again, is a type of adrenaline. By doing that, it helps lower your blood pressure. Vasodilator is class of medication. Again, it basically dilates the blood vessel. By doing that, by dilation, it lowers your blood pressure. So this is general mechanism of action for the most common hypertensive medication that we have right now.
As you can imagine, for a new drug, a new treatment modality to cut into the hypertension space, it has to have a novel or different mechanism of action, and it has to deliver efficacy, also excellent safety to compete with the generic. Or else, even if the new drug is FDA approved, it won't be able to generating market success. That is to say, it won't become blockbuster. Here, Dr. Lin shared with us on the various novel treatment modality, both medicine and also devices to treat hypertension.
I'm going to discuss a few of the currently medications that are ongoing that create a lot of excitement. One is called lorundrostat. Now, lorundrostat, as I said earlier, is an ASI or aldosterone synthase inhibitor, where I said earlier it blocks the production of aldosterone. And by blocking the production of aldosterone, it promotes stone retention, meaning that your body, because aldosterone promotes stone retention, it causes high blood pressure. By blocking the aldosterone, it lowers your blood pressure and also lower your risk of heart failure as well. So there are a phase 2 study that has been done and have very positive results and show significant improvement in patients who have resistant hypertension and with minimal side effects. So that's why, those two, because the minimal side effect and effectiveness, there's been a lot of excitement in that. And right now they're in the middle of a phase 3 clinical study, and they're expecting results probably in the end of the year or maybe in 2025. And again, as I mentioned, this is not no financial advice, only for us to be aware and further evaluation. But the company that is involved in lorundrostat is called Mineralys. It's a mid-cap company with market cap about $400 million. So, there's a sign that gives them room to grow. So, like I said, it's a company we keep an eye out and then do further evaluate from the financial fundamental part of it to see whether this is a company that maybe, we may be interested in investing in the future. Other class of medication is an SGLT2 inhibitor, sodium glucose co-transmitter. A medication that's being studied is empagliflozin. There's a mouthful there, right? Now, this medication actually been approved for diabetes type 2. The way it works is basically it removes excess glucose and sodium through the urine, and it's shown to decrease blood pressure as well, in addition to decrease weight and help with cardiovascular risk. So there's a study going on, see if it can be FDA approved for blood pressure specifically. And this one is also interesting. This is actually a non-pharmaceutical technique to treat blood pressure. It's called a baroreflex activation therapy, or the BAT, for a patient who resistant high blood pressure. What it is basically a device. It stimulates the carotid artery in the neck, and by doing so, it helps lower your blood pressure and also lower your heart rate. So it gotta be, you gotta be careful there, because you don't want to lower your heart rate too much, because it can be dangerous. So there are clinical study going on right there. So you look at that initial cartoon of a symptom having that blood pressure neck with his neck, maybe he's onto something, right? So that's what we have right now. So it's like I said, hypertension is a big, broad field with a lot of patients having them. So it's important for us to keep up to date on them. So thank you very much, and I'll be glad to have any question, any question.
If you enjoy our video, make sure you hit the like button, subscribe to our YouTube channel, share it with your friends and your family. Also, just tap. You don't have to smash on the bell notification button so that you can get our video as soon as they are released. Now, the other thing I want to share with you about is that our fund, we have weekly open mic webinar where our leadership team meet, and our chairman of the medical and scientific committee, that is Dr. Van Nguyen. He's a cardiologist, also medical director, and he and our team present on the latest advancement in the life science sector. We cover many niche, many topics, which allow me to gain an advantage in the life science sector, and in knowing so, I can fine-tune my research position and invest in young innovative companies before they blow up big. Let us capture the tremendous upside in the biotech stock market that will occur in the next few years for you. If you're interested in learning more about our fund, you can check out our website, www.evergrowthinvest.com. You can also reach us by email, info@evergrowthinvest.com, or by phone, 704-957-7746. Reach out to us to see if we are the right fund for you and if you are the right investor for us.